This is number 10 in the series of videos, where I'm going to show you the recommended way to use the Autobott with our ultrasonic scaling machine then. Okay, a few things first. It's very advisable when you're using the Autobott to only fill up the bottle 3/4 of the way, and always ensure that you use drinking water or water from the bottle, because obviously this water is going to go into your patient's mouth, so it needs to be clean water. The reason we only fill it up 3/4 of the way is so we have some air gap in the bottle. In the base of the Autobott system then, there's a little tiny compressor, and this sends air into the bottle itself. Now if you was to fill this bottle all the way to the top with water, there would be nowhere for the air to sit when it's compressed, so that the bottle wouldn't work as it's supposed to. So that's why we always recommend you fill it up 3/4 of the way, so you've got some space for air. Very important. Next thing to check then, as I showed you before, make sure the little tail on the rubber pipe is connected to the cap correctly, and make sure that the little silicone seal on the top is pushed all the way out. Okay, so you've filled your bottle up with water 3/4 of the way. Place the cap on, and as I said before in a previous video, ensure this is nice and tight, because we don't want to have any air escaping during use. Once it's on tight, nice and firm, push the bottle onto the base of the Autobott. Okay, we've made all our connections then. The scaling machine is turned on, as we can see by the green light. And the next thing we're going to do then is turn on the Autobott to pressurise the air inside the bottle. First couple of things you're going to notice when you turn it on is you're going to hear a buzzing sound. And that buzzing sound is telling you that the compressor is working and is compressing the air inside the bottle. Once the air inside the bottle reaches the correct pressure, the little compressor in the base will turn off. So it's not on all the time, it's only on when it's required. So I'm now going to turn it on, and you'll probably hear the compressor working. There you can hear it working, compressing the air in the bottle, and it's now stopped. That's telling you that the air in the bottle is now compressed enough for use with the machine. That's all you need to do. If you do find that the air compressor is staying on longer than that, then ensure that the cap is screwed on correctly, because obviously air is leaking from somewhere. Okay, next thing we need to do then is get this water to the machine itself. So we've already connected the handpiece, we've already connected the scaler tip, so remove that, and on the machine itself is the water control. If it's turned all the way to the right, there will be no water flowing. And if it's turned all the way to the left, there will be maximum water flow. So to get it going then, turn it all the way to the left so we have maximum water flow, because we need to get water into the system. Okay, once you turn it all the way to the left, depress the foot pedal of the scaling machine and wait for the water to come through. You'll hear the Autobott start making a noise, and then now you can see the water is coming through. And you can now adjust it to the correct water flow for what you need for whatever procedure you're going to be doing. And that is now the water flowing from the Autobott into the machine successfully, without problem. As I said before, if you do find that the compressor is staying on for an extended period of time on the Autobott, ensure that the little silicone seal in the cap is firmly in its correct position. Ensure that all the pipework is connected correctly and there's no leaks, and also ensure that the pipework is connected correctly on the scaling machine itself. If all those connections are correct, then you will have no problems at all. During use, the little compressor in the base will come on intermittently, just to make sure that the pressure is correct in the bottle itself.